This episode of GT the Podcast is supported by Alcon.
This is Ike Ahmed.
And I'm Arsham Shaybani.
And we want to welcome you to GT the Podcast.
We're bringing this to you together with BMC and Glaucoma Today,
to offer audible insights into current topics in glaucoma care.
Presented by the authors of our latest, most read GT articles.
Check it out.
Welcome to GT the Podcast. In this episode, Dr. Ticiana De Francesco, a glaucoma and anterior segment specialist, recaps her article, Noninvasive Trabeculotomy Treatment for Glaucoma, which was written with Dr. Ike Ahmed and will be featured in an upcoming issue of Glaucoma Today. In this article, the authors describe femtosecond laser, image-guided, high-precision trabeculotomy, or FLIGHT, a new procedure that could help expand options for safe and effective glaucoma intervention. Here, Dr. De Francesco shares perspectives from the first in-human experience with this technology.
MIGS represents a significant development in the management of primary open-angle glaucoma, and patients around the world have benefited from these procedures. However, several challenges in this space remain to be addressed fully. The requirements for certain procedures to be performed with cataract surgery, the incisional nature and technical challenge of OR-based procedures, surgical trauma and variable healing responses among patients, and the risks of surgery may all limit the widespread use of MIGS. New treatment approaches continue to emerge to address unmet needs in the management of primary open-angle glaucoma. One such approach is femtosecond laser image-guided high-precision trabeculotomy, or FLIGHT. This article shares our perspectives from our first-in-human experience with this technology. The ViaLase laser system combines femtosecond laser application with a specialized OCT modality with micro-level accuracy. With the platform, the user can visualize the target tissue and apply an image-guided gonioscopy femtosecond laser treatment to a precise location to remove a defined portion of the trabecular meshwork and inner wall of Schlenz canal non-invasively. The use of a femtosecond laser to create channels within the trabecular meshwork has been linked to improve outflow facility. The precision of the laser may also help to minimize collateral damage to surrounding tissue. FLIGHT differs from selective laser trabeculoplasty in that SLT enhances outflow facility with a purported cellular turnover and/or biologic phenomena. Over time, reaccumulation of extracellular matrix may reduce outflow and limit the IOP lowering effects. FLIGHT creates distinct physical channels in the trabecular meshwork to allow direct aqueous outflow into the collector system and may therefore offer a more durable effect than SLT. The non-invasive nature of FLIGHT is a significant advantage. The ViaLase femtosecond laser is used to create a trabeculotomy, eliminating the need for a corneal incision. The use of intraoperative OCT to visualize potential collector channels and target channel creation may help to maximize target outflow, guide surgical planning, and optimize surgical outcomes. The patient's lens status has no bearing on their ability to undergo FLIGHT. Patients have tolerated the treatment well, reported little to no discomfort or pain, and experienced a fast postoperative recovery, quickly returning to their normal activities after treatment. Because FLIGHT does not have to be performed in a sterile environment, the treatment may be used in a variety of settings. The individual non-invasive components of FLIGHT, i.e. OCT and femtosecond laser, are familiar to ophthalmologists, meaning new users may be able to grasp the steps of the procedure more quickly. In a recent single-center, non-randomized prospective study, 18 eyes of 12 patients with open-angle glaucoma were treated with FLIGHT. In each patient, a single trabeculotomy channel measuring 500 micrometers by 200 micrometers was created. At 24 months, mean IOP was reduced by 34.6% from 22.3 plus minus 5.5 to 14.5 plus minus 2.6 millimeters of mercury, with P less than 0.00005, with an average of 2.0 plus minus 1.2 hypertensive medications compared with 2.2 plus minus 1.1 at baseline. P was 0.22. 14 out of the 17 study eyes, 82.3%, achieved a 20% or greater reduction in IOP at 24 months when compared with baseline. Notably, no serious device-related adverse events were reported in this study. A multi-center randomized controlled trial is in progress to assess the safety and efficacy of flight. Further explorations are warranted to evaluate safety, compare short and long-term outcomes of flight, SLT, and MIGS, and determine where flight fits within the overall glaucoma treatment paradigm. The flight procedure has the potential to take advantage of the known benefits of MIGS without presenting the risks associated with incisional surgery. Issues associated with drug therapy for primary open-angle glaucoma, compliance, adverse events, and quality of life challenge may be mitigated by a laser-based approach. Further, earlier intervention may minimize visual field loss and reduce the need for more invasive glaucoma surgeries. The potential of this intervention to improve treatment offers for primary open-angle glaucoma is encouraging. Flight may provide a safe, non-invasive method that overcomes challenges related to visualization and device laser placement, reduces concern regarding compliance, and may generate similar outcomes to OR-based surgical procedures.
Thank you for tuning into this episode of GT the Podcast. If you have any feedback or topic suggestions, find us on Instagram, LinkedIn, Facebook, or Twitter. And stay tuned for more hot topics in glaucoma care on GT the Podcast.